Hi, my name is Grace Lang, and I'm excited to talk to you today about trichotillomania. Before we jump into what trichotillomania is, I want to ask you, have you ever felt like you were born into the wrong generation? I remember this phrase being used a lot when I was in junior high. I never really related to it until I was sitting in an art history class last year. My professor put this painting on the screen. She told us about how, according to 15th century beauty standards, thin eyebrows and receding hairlines was the epitome of beauty, so much so that people would shave their hair back and pluck their eyebrows. In this moment, I finally felt like maybe I was born into the wrong generation. That is because I have trichotillomania. My laptop is often littered with eyelashes, and I have to keep glasses with me at all times as an attempt to keep myself from pulling out my hair. This is a picture from when I finally remembered to grab my glasses out of my car after a week of not having them. Sometimes I have lots of eyelashes, and other times I have none. You can also see that my eyebrows are a victim of my hair pulling as well from this picture. Trichotillomania is also known as TRIC or TTM, is a neuropsychiatric disorder characterized by chronic, repetitive, or compulsive hair pulling, resulting in noticeable hair loss. Some symptoms include irresistible urge to pull out one's own hair, which can be focused or an automatic response, repeated attempts to stop, or a growing tension in resisting the urge, a sense of satisfaction, relief, or pleasure after plucking out hair, biting, eating, chewing, or general playing with pulled out hair, hair loss marked by bald patches, hair thinning, shortening, sparse, or missing eyelashes and eyebrows. Trichotillomania is part of a larger group of behaviors called body-focused repetitive behaviors. These include any repetitive self-grooming behavior that involves biting, pulling, picking, or scraping one's own hair, skin, lips, cheeks, or nails that can lead to physical damage to the body and have been met with multiple attempts to stop or decrease the behavior. My family pedigree is completely filled with various BFRBs. For example, me and my brother both pull out our hair. My dad and my oldest sister, however, pick at the acne on their face. My mom picks at the skin at her lips, and my sister picks at her ears. Trichotillomania can have many causes, such as genetic predisposition, other mental health conditions such as depression, anxiety, OCD, body dysmorphic disorder, post-traumatic stress disorder, attention deficit hyperactivity disorder, and substance use disorder. Environmental factors such as stress, substance use also play a factor. There is evidence that trichotillomania is caused by the heterozygous mutation in the SLIT-RK1 gene on chromosome 13q31. SLIT-RK1 is found to be involved in neurite outgrowth, which is required for the complex interplay of both extracellular and intracellular signals. One twin study showed that concordance rates among monozygotic twins was 38.1%, and for dizygotic twins, 0, using the Diagnostic and Statistical Manual for Mental Disorders criteria, as well as 58.3% for monozygotic twins and 20% for dizygotic twins using the non-cosmetic hair pulling. This leads to a heritability estimate of 76.2%. While there does seem to be a connection between the SLIT-RK1 gene, recent studies haven't replicated this data, suggesting that more genes could be involved in the disease and that more research is necessary to finding the root cause of TTM. The gold standard for treatments of TTM is habit reversal therapy, a form of cognitive behavioral therapy. Other therapeutic treatments have also been proven to be effective, including comprehensive behavioral treatment, acceptance and commitment therapy, and dialectical behavioral therapy. The underlying theme with all these psychotherapeutic modalities is focused on developing awareness of triggers, including reducing the guilt or shame that may accompany the condition, while developing improved distraction and coping skills. Other options for treatments are N-acetylcytosine and olanzapine, which are medications used to help decrease the symptoms of anxiety and OCD, as well as specific options for improving distraction and coping skills, which include wearing glasses or a hat or bandana on the head. This condition is chronic with ebbs and flows of good and bad periods of plucking and pulling. Little concrete research has been done on treatment options. More research on both effective treatment options and the root cause of trichotillomania could give hope to those who struggle with TTM.